when medications interfere with romance, plus how to discover your deepest desires, even if you don't think you have any. Everything you wanted to ask about sex but didn't. Now you can ask Dr. Leah, sexual health expert and associate professor in the Department of Health and Human Performance. Here she is, Dr. Leah.
Thanks, Derek. It's great to be here today with all of you. I'm Dr. Leah Janine. We're here to answer your questions about sex and relationships. We have a lot of the latest research and a little common sense. Plus, we have a therapist here to reveal how she helps her clients manage major disagreements. But first, let's take some viewer questions.
Well, here we go, Dr. Leah. Our first question. A viewer wants to know, can you use massage oil as a lubricant during sex?
Well, some lubricants can double as massage oils, but it's not usually a good idea to use a massage oil as a lubricant during sex. The vaginal tissues can't clear the oils quickly, and some women get an irritation or even a yeast infection from the essential oils. Plus, most lubricants don't work well as a substitute for a massage oil.
Dr. Lee, I'm sure all massage oils are not created equal. What should they look out for?
Stay away from products that contain glycerin because it can become sticky. Non-glycerin, water-based lubricants are safe for both types of massage, but they do tend to dry out quickly. If you like the body massage oil you use, you should wash your hands and switch to a sexual lubricant for female genital massage and penetration. If you don't want to interrupt the massage, you can always try a silicone-based lubricant. They don't contain water, so they won't dry out quickly, and they're safe to use on both your body and your genitals. However, they don't soak into your skin, so they may need to be washed off. Just make it fun and take the opportunity to take a sexy shower with your partner.
How can I have remove the massage oil party in the shower? That's a great idea. Can any double as both, Dr. Leah?
Yes, there are some like coconut oil. It's loaded with vitamin E and healthy fats, so it's good to use for a massage on your hair, and you could even cook with it. It's packed with moisturizing agents and keeps your skin hydrated without changing your pH level. It can offer protection against microbial infections and treat issues caused by bacteria or yeast. Coconut oil also has strong antioxidant properties that can help the healing process of your skin, and it has a good smell.
Is there anything else, Dr. Leah?
Yeah, grapeseed oil is another option. It's light and has a smooth texture that can easily slide onto your hair or your skin. It has a long shelf life, so it won't go bad anytime soon. A third choice is sweet almond oil. It also contains lots of antioxidants to keep your skin soft and irritation-free.
A woman wants to know, are bidets safe to use for the vagina and rectum? Are there any risks?
Well, if you don't know what a bidet is, it's a toilet-like bowl or a fixture that uses water to clean the area after you urinate or have a bowel movement. There are some risks to using a bidet, especially if you're female. Bidets could upset the healthy ecosystem of bacteria in your vagina. Plus, bidets can also be harmful for women who are having a high-risk pregnancy.
How can it be? I mean, isn't that supposed to keep you clean? How is it supposed to be harmful? How can it be harmful?
Well, hopefully that's the goal, but the big concern is that the bidet's nozzle may get contaminated with germs if it's not cleaned and sanitized properly.
Okay, so Dr. Leah, so how do you do to avoid this?
Well, if you do use a bidet, you need to make sure you're using it correctly. Make sure the water pressure is not too high, as it could cause serious damage like rectal prolapse. If there are temperature settings, double check to make sure that they're not too high, or you could get burned. The angle of the stream should also go from front to back to keep any fecal matter out of your urethra and vagina so that you don't get any additional infections.
I'm sorry, Dr. Leah, rectal prolapse?
Yeah, so rectal prolapse occurs when the rectum turns itself inside out and comes through the anus. Sometimes this will go away on its own, and other times it will eventually need to be pushed back in manually. Women are actually 6 times more likely to suffer from rectal prolapse than men.
But they can be good if they use it correctly.
Bidets can be good for those with limited range of motion and the elderly. If they're used correctly and kept sanitized, they can do a good job keeping you clean. So I see nothing wrong with a personal bidet, but I'm not sure that I'd want to try to risk it with a public one.
Gotcha. Beautiful. All right, our next question, Dr. Leah. A man says, I masturbate 4 to 5 times a week, even though I'm married. Is that excessive? And if so, how problematic can it be? Does this mean I'm addicted to porn? I hope not.
I won't even address that one. According to a national survey, about a quarter of the men between 18 and 59 surveyed masturbated a few times a month. About 20% masturbated 2 to 3 times each week, and less than 20% masturbated more than 4 times a week. So you might be in the upper fifth of the population. But I don't see any reason for concern. Most women, just so you know, on the other hand, actually masturbated less than once a week. But differences in frequency are often due to satisfaction with one's current sex life or mismatched sex drives. But masturbating 4 times a week is not necessarily a problem unless it becomes compulsive.
Compulsive meaning over and over and over? Or I mean, what are the signs of masturbation compulsion?
Well, I mean, yeah, it's a vague term, right? If masturbating takes up a lot of your time and energy, or your home life or work life is suffering, like you're late for meetings or appointments, or you're canceling events because you can't wait to masturbate, you masturbate when you're not even aroused, or you find it just difficult to stop thinking about masturbation, those would all be signs that it's compulsive.
So this is psychological, right?
Compulsive sexual behaviors can be neurological if the natural brain chemicals are unbalanced. Some research suggests that behavioral addictions might alter the brain's neural pathways, similar to substance abuse disorders.
So masturbation abuse disorders, what's the solution for that?
Well, some people can stop compulsive masturbation on their own, but others might need the support of a group or a professional therapist. Talk therapy is a good way to find out whether or not your masturbation is actually having a negative impact on your life. They can ask questions about your feelings and behavior around masturbating and whether or not you engage in other compulsive behaviors. Past traumas and what stresses you out may also be to blame.
Still to come on Sex Talk. When sex doesn't satisfy. Relationship challenges. Conception myths.
Dealing with bad sex doesn't have to be a deal breaker. Here are some tips to improve your physical connection.
Dealing with unsatisfying sexual experiences can be challenging to navigate, but it doesn't have to be a deal breaker. Effective communication is key to addressing these issues. Partners should create a safe, non-judgmental space to discuss their desires, boundaries, and concerns openly. Understanding each other's needs and preferences is essential for improving sexual intimacy. Seeking guidance from a trained therapist or counselor can be valuable in identifying the root causes of dissatisfaction and learning techniques to enhance the sexual relationship.
Keep in mind, most couples deal with unsatisfying encounters, so don't be too hard on yourself or your partner. Coming up, a therapist is here to offer tips on dealing with disagreements with your partner. Plus, a viewer wants to know how to make shower sex more comfortable and more romantic.
If you have a question for Dr. Leah, please send an email to questions@allhealthtv.com. Find out more about Sex Talk. Go to askdrleah.com.
Welcome back to Sex Talk. Today we have relationship expert and owner of Buksani Counseling Care, Dr. Rachna Buksani Mirpuri. So, thank you so much for being here.
Thank you for having me.
So we're just going to jump right in. What are some of the common difficulties and conflicts that you see in your office?
Some of the common causes or topics that we see are finances, career, children, where I want to live, but really all of that arises from my value system. Something that I hold dear to my heart may be different than what my partner holds dear to their heart. And generally, individuals are not ready to compromise on those value systems. So when there's a clash of the value systems, that's where we see a conflict in the couple.
Okay, so a friend of mine was recently in an argument with her husband while driving in a vehicle and just wanted to stop the argument, so she took off her shirt and bra. It didn't proceed to anything sexual, but what do you think about using sex maybe as a way to deter an argument?
Extremely creative. I don't want to say adaptive coping mechanism, but creative coping mechanism. I still think they need to go back and deal with the issues because, Leah, you know what? In couples, we don't fight about different things. There are perpetual problems. We're fighting about the same thing again and again, right? So this time that worked. Next time, I don't know. I mean, again, your friend is I have to give her kudos for being creative, but her best bet is to go back and visit those perpetual issues so that they can find a resolution.
Well, since most couples are talking about the same thing over and over, what is the first step to really stop that perpetual disagreement?
I think the first step is always going to be about enhancing communication, right? So to build an understanding between the couple. If every time I say something, you're going to feel attacked, if we are a couple and you feel attacked, or if I say something and you become defensive, we're not going to be able to actually get to any resolution. So really, the first step is to explain to couples how to talk about conflict. And that's kind of what we do in our therapy sessions. We talk about the 4 horsemen of communication that really lead to, it's the beginning of the end of relationships. So we talk about the, from the Gottman method, but we talk about the stonewalling, the contempt, the criticism, the defensiveness, and how to really deal with those 4 horsemen to be able to communicate effectively with your partner and thus make marriages work.
Is there ever a time when you don't actually need to resolve the conflict? Just is it better to ignore it ever?
I'm a big proponent of communication. I feel like it's, sure, if you're having a bad moment and it's purely me and it's coming from me, it has nothing to do with my partner, maybe sure. You know what, let it go because it's just a bad moment and you have self-reflected that it isn't an issue in the relationship. But really, if it's something that's coming in the way of you and your partner having a meaningful and fulfilling relationship, I think it's always better to talk.
Okay, so what advice would you give to a couple that wants to avoid that conflict?
So that's a very common response, right? Remember, conflict makes people anxious. And I have the 3 Fs. So I freeze, I fight, or I flight. And a lot of couples will, so the avoid that you're talking about is flight. I'd rather run away. I don't want to have, I don't want to deal with this. And that's again where these communication strategies are important, right? Because if I can learn how to talk to my partner and my partner can learn to listen to me without becoming defensive, we can have effective communication and resolve those conflicts.
Great. Well, thank you so much for joining us.
Thank you.
And we will be right back with more Sex Talk.
Still ahead on Sex Talk. Taking the pill on time. Discovering your fantasies. Can a smell trigger arousal? Dispelling myths about getting pregnant.
Back here on Sex Talk, let's take some more questions from our viewers.
A woman asks, does it matter if I take the pill on the same time every day?
Yes, depending on the type of pill you're taking. There are 2 main types of birth control pills, combination pills and the progestin-only pill or the mini pill. Both the combined and the progestin-only pills are highly effective with perfect use. They only have less than 1% chance of becoming pregnant. But the failure rate goes up to about 9% with inconsistent or incorrect use.
I don't like the sound of incorrect use. So which one must be taken at the same time?
Well, if you're taking a mini pill or a progestin-only pill, it must be taken at the same time every day. And if you skip a pill or more than 3 hours late, you should take a pill as soon as possible and use a backup form of birth control for at least 2 days. If you skip or take the combined pill late and it's been less than that 24 to 48 hours, you should still be protected, but you should also take that pill as soon as possible. No matter what type of pill you're on, taking the pill at the same time every day is a good idea, especially if you make it a part of your daily routine. I'm also a big fan of alarms. We all have our cell phones with us all the time, and it provides an excellent backup.
So consistency is key, correct?
Yeah, absolutely. Bottom line, if you consistently take the pill within a 24-hour time frame every day, you're not very likely to get pregnant. But missing pills is the most common reason that women do get pregnant on the pill. And I actually know someone who got pregnant on the pill who claimed she took it every day, but she was really inconsistent with time. And if you think about it, she was a morning person, taking it every day at 6 a.m. Well, if she forgets and then takes it that day at midnight, you're actually close to the next dosage. So even though it's technically the same day, that's a really far window apart.
Doctor, are there a lot of misconceptions out there or myths?
Yeah, absolutely. There's a lot of conception myths out there, and later on in the show, we'll cover some of the biggest misconceptions.
Great. Let's move on to our next question, Dr. Leah. A man says, I'm on BPH medications and sex just isn't working for me anymore. Doctor, can you explain BPH first, please?
Yep, BPH, or prostatic hyperplasia, is a non-cancerous enlargement of the prostate gland and can affect men as they age. It can also affect your sex life by reducing your sex life, lessening sexual satisfaction, or even causing erectile dysfunction, or ED. Some of the symptoms of an enlarged prostate include frequent need to urinate, increased urination at night, weaker stream, and intermittent urination. Sometimes men will even have blood in their urine or urinary infections.
Ouch, blood in your urine. They probably see a doctor, right? I mean, okay, so how exactly can the medications affect sex?
Some drugs can be used to treat BPH, can also cause you to have a reduced sex drive and less satisfaction along with ED. One drug, Proscar, has been linked to ED in almost 4% of men using it, with over 3% having a diminished libido. Flomax can also improve BPH symptoms and has a lower risk of sexual side effects. And this isn't just used for BPH, it's also used for hair loss.
For hair loss? I think we cover that topic also on our Smart Life show on PBS, to get more information on that. Yeah. Dr. Lee, what are some other solutions?
Well, you could try using ED treatments like Viagra or Cialis. They can also improve BPH and reduce urinary problems. But speak to your doctor to see if they're compatible with medications that you're already taking. Also, try a couple of lifestyle changes. Eating a heart-healthy diet and staying active can help because some risk factors for BPH and ED are the same. So eat foods that are anti-inflammatory, high in omega-3 fatty acids like salmon, and vegetables like broccoli and kale, all good for your prostate. There are also surgical options that you might explore, but some of them do also have sexual side effects.
If you have a question for Dr. Leah, please send an email to questions@allhealthtv.com. Find out more about sex talk. Go to askdrleah.com.
There's a lot of misinformation about what leads to pregnancy and what prevents it. We have the truth on some of the most common myths.
Conception myths can sometimes mislead couples and create unnecessary stress. While some may contain a hint of truth, it's crucial to separate fact from fiction when it comes to fertility. Common misconceptions include the notion that certain sexual positions increase the chances of conception, or that having intercourse every day is the key to success. In reality, the timing of intercourse concerning ovulation is more critical than positions, and frequent sex may not necessarily boost fertility. Other myths involve dietary recommendations, like consuming certain foods to enhance fertility. While a balanced diet is essential for reproductive health, no single superfood guarantees conception. To optimize your chances of conceiving, consult a healthcare provider, maintain a healthy lifestyle, and educate yourself on reliable fertility facts rather than relying on misconceptions passed down over time.
Don't believe everything you hear or read on the internet. If you're unsure, ask your doctor. It's likely not the first time they've been asked. Let's take on some more questions.
Dr. Leah, a lot of our questions are kind of similar to other questions, but this particular next question is pretty unique. It's the first time here. A woman says, my guy loves the smell of my underwear, but I think it's gross. Is this typical?
Well, due to limited studies and underreporting, there are really no numbers of prevalence of this fetishism. However, there is a market for used underwear online, so I'd presume it's actually not that abnormal.
I'm sorry, they sell used underwear?
I remember when this became big, people would take pictures of themselves, like not their face or anything, their lower body in wearing the underwear, and then they'd mail it off for a price, and people paid for it.
Wow,
so,
okay.
Yeah, I think it would weird me out a little bit, but I mean, if that's what they want to do.
You know, if people are willing to go that far, I mean, what is it that attracts people to this?
Well, smell could trigger our limbic system, the unconscious part of our brain, and it plays a big role in how we make our decisions and what we enjoy and what we like. If you smell delicious food cooking, your body will release chemicals to your digestive system, getting it ready to digest the food. The same thing with a potential partner's body odor. It can help decide if we're attracted to them or not. When we smell someone that arouses us, it can trigger the release of hormones in our reproductive system.
Dr. Lee, you've researched this, other researchers. What do you have to say about this?
Well, there was a study where women were exposed to an acute stressor and their stress and cortisol levels were then measured. They were then given 3 different scents to smell, one from their romantic partner, one from a stranger, and one from a neutral scent. When they smelled their romantic partner's scent, their stress levels were lower. I mean, whenever I'm stressed, I actually will have my husband lie on top of me. He thinks this is probably a little weird. And maybe it's the smell. I mean, it also activates your parasympathetic systems. So there's a plethora of reasons why it really might just calm you down.
Dr. Leah, if my wife is stressed and I sit on her or lay on top, she's going to give me a right cross right to the, I'm going to have a black eye.
I think you have to ask first. I mean, now he's used to it, but the first, I was looking at it because he said, why is this so calming? Why is it when you're really stressed, you just ask me to lie on top of you? I mean, some people cry, some people yell. I'm really not that emotional, so for me, it's just he lies on top of me, I feel better.
Like I said,
and it's not in a sexual way. It's just kind of comforting.
Okay, good. So another word, a parasympathetic system. That's the bottom line, then, right?
Yeah. So it's an activated response to the sympathetic nervous system, which drives that fight or flight response in stressful situations. The main purpose of the parasympathetic system is to conserve energy to be used later and regulate bodily functions like digestion.
Okay, but I've met your husband and he's pretty big if he lays on top. Anyway, so let's get back to the underwear. Is it okay or is it a red flag?
Well, your guy could be in love. This person's guy could be in love with the smell of the underwear because it turns him on. Or maybe it helps him relieve stress, or maybe a combination of both. But you should definitely talk to him about it without judgment and ask him to explain how he feels when he smells your underwear. If it's too gross for you, and just try another piece of clothing and see if that could work as a substitute.
Okay, thank you for that. Dr. Lee, a viewer says, my partner loves sex in the shower, but it's a lot of extra work. Is there any way to make it work better?
That's rough, right? Someone is always freezing, plus it sets you up to slip. And water is not a lubricant. In fact, it could actually make you feel more dry than wet because it's wiping out your body's natural lubricants.
Besides bringing in a rubber ducky, how can you make the situation better?
Safety first, right? I have a huge fear of falling in the shower. So safety first. Make sure you have a rubber bath mat, suction cups so you won't slip, and that will give you and your partner some extra traction. Make sure that there are no loose shampoo bottles rolling around or anything else that might make you lose your footing. If you don't have one, think about getting a shower seat or a foot stand that could expand your range of positions. Be careful using bath oils as they can make things, including you, very slippery. Do think about using lube on each other's genitals before you head into the shower. I mean, that could be part of your foreplay. Be careful though, your bodies can get overheated. I like really hot showers, and that could cause your muscles to get lax, and even in some rare cases may cause one of you to faint. To keep yourself stabilized, make sure your and your partner's knees are never locked out.
So proper form, right?
Absolutely.
Okay, what else, Dr. Leah, in your opinion?
Well, where you aim the shower head is also important, right? You want to make sure it's hitting your back, chest, legs, instead of your face. And because water can create friction between you and your partner's genitals, you don't want the water aimed down there.
Okay, how about toys? Can you use those in the shower?
I guarantee there is a sexual rubber ducky out there somewhere. I guarantee that's a thing. But yeah, you can. Don't forget about toys. Think about bringing a waterproof vibrator or anal plug into the shower with you. It can take away some of the pressure of finding the right position and adding new excitement.
Woo, okay. I'll look at showers in a whole different way now. A viewer wants to know, how do you discover fetishes and fantasies? My partner asked me, but I don't think I have any. This might be the dumbest thing I'm going to ask, but wouldn't somebody know to have a fantasy or a fetish?
Well, it really depends. If somebody had an upbringing that shamed sexual behavior, it may be suppressed. Maybe this person just doesn't know where to look for them. The first thing that you need to keep in mind is that everyone has different turn-ons, and you shouldn't judge yourself if and when you discover a fantasy or a fetish that you'd like to explore.
Okay, that's great advice, but where should they start?
Well, to start out, think about past sexual encounters or experiences that you found to be arousing and figure out what it was that turned you on. Or do you think about a sexual scenario when you masturbate? That could turn into a fantasy that you can do with your partner. Try watching porn or reading an erotic book. I know most people don't do that anymore, but consider which scenes or segments really turn you on the most. Look for some sexy social media sites that can give you some ideas about what you might want to try. You could even try Googling fetishes and sexual fantasies to get ideas.
When should they think of involving their partner?
When you feel confident and ready to start. You might even want to share the fantasies and fetishes that you want to explore, but set some ground rules about what is acceptable and choose a safe word that means no or stop. Also remember, if you try one and it doesn't work, that doesn't mean that they all won't work out. Think about what went wrong. Was it the idea, or was it how you and your partner played it out? You can always try again, or just move on to a whole nother idea. Well, Derek, that's all the time we have for today, but you can still send in your questions. I'm Dr. Leah Janine, and we will see you next time when we answer the questions you've always wanted to ask on Sex Talk.